All right, everyone, we're going to get into concept B2 here, female reproductive system. We have covered concept B1 last week, talked about the male reproductive system. Don't forget that we also talked about the process of spermatogenesis and sort of did an exploration of the supporting structures that were responsible for ensuring sperm that can survive in long enough in the female system in order to get to fertilize an egg. So don't forget about the seminal vesicle and the prostate gland, the Cowper's gland, those kinds of things. What we're moving on to today in concept B2, it's a relatively short concept, is the female reproduction system, reproductive system, and we're going to highlight particularly these structures here: the ovaries, fallopian tubes, uterus, endometrium, cervix, vagina. And then we're going to talk a little bit about hormones associated with the system, and we're going to talk about oogenesis or oogenesis, depending on who you talk to, which is the process of creating a viable egg cell. So we're going to get through that today. It's a relatively quick concept to get through, I think, and then you guys will have a worksheet that I'll put up on the Google Classroom that you can work your way through. And it'll review both systems, allow you to compare the two, which is really good. And then a little bit of studying should get you to the point where you are ready to do the quiz for concepts B1 and B2. So B1 is male reproductive system, spermatogenesis, seminal fluid. B2 is female reproductive system, the parts, and creation of egg cells. So we're going to jump into this in a second here. I'm just going to hit pause because I wanted to go check on something, and then I'll join you. Well, for you, it'll be an instant. I'd like to know from you guys too if the camera is a distraction for you or not as we move along here. I just did it because I thought you guys might want to see my face, but we'll go on and let me know at some point in a comment or an email or something whether you care about having the camera on or not. So the female reproductive system is in many ways more complicated than the male reproductive system. In males, sperm is produced pretty much constantly following the onset of puberty, whereas in the female system, after the onset of puberty, one egg, mature egg or ovum, is released per month. And so there's a lot more complications associated, not complications, the female system is more complex than the male system in many ways because of the need to mature an egg rather than just create sperm, and in order to allow for a female to bear a child as well. So that makes it more challenging in some respects, and more complex, need for a more complex system. So the function of female reproductive system is simply to accept sperm from the male and to provide an egg or gamete for the sperm to fuse with during fertilization. Then it gets complicated because then the system also needs to be designed to develop a fetus in order for reproduction to be successful. So there's a requirement for the female to have the right parts in order to develop and give birth to a fetus if everything is successful. So here's a quick diagram of the female reproductive system. I'm going to open up my pen here and just make sure that we can highlight the things that are important that I need you to know, and then we can cross off some things that are not necessarily important for you to know. So I'm going to start on the top left diagram. It's a little harder to see on here, but the ovaries are the female gonads. So in males, the testicles are the female gonads. That's where the sperm are created and matured mostly. And final maturation, we know, occurs in the epididymis. In the female system, it is the ovaries where the eggs are stored and matured once per month, which we'll get to here shortly. So the ovary is a little structure. This is a side view of the female system, and so the ovaries are a little harder to spot. This would be a front view of the female system down here in the bottom right, and you can see that the ovaries are there are two ovaries, one located on either side of the body, attached to the fallopian tubes, which we don't see on this top left diagram, but we certainly do see in the bottom right diagram. The bladder, I'm only going to point out the bladder here, just for the sake that it's in very close proximity to the uterus. And so you can imagine if you're carrying a child, and the child is growing larger and larger and larger, the bladder is going to be put under more and more pressure because of the close proximity to the uterus, which is that structure there. You guys don't need to worry about the symphysis pubis or the mons pubis. We don't really need to worry about the clitoris. The labia majora and minora are the external parts of the female system, really not of value for us to learn with respect to reproduction and children. Urethra, you definitely, so we can really cross the labia out. For the urethra, just to make a note, in comparison with the male system, in the male system, the sperm and the urine travel through the same urethra, and that posed some complications for the sperm, which were solved by some of the glands and the seminal vesicle that the sperm passed by. In the female system, the urethra is separate. It's this structure right here, this little passageway that leads from the bladder, and that system is quite a bit. It is not connected or associated with the passage of fetus when it's being delivered, or with eggs or anything like that. The vagina is this structure here. It's a muscular structure. We'll get to describing these in a minute, and it's the birth canal, but it's also the spot where sperm is released in order for fertilization to occur. Rectum is here just for more than orientation. You don't really need to know that structure. The cervix we will talk about frequently, and the cervix is one way to look at it. We'll get into it in more detail later, but it's kind of the bridge between the vagina and the uterus. So the cervix is kind of that bit there, and then the uterus is this muscular structure here that is attached to the fallopian tubes, which I said we don't see on this diagram, but you do need to know the fallopian tubes are here, and those are the tubes that connect the ovaries to the uterus. And the uterus is a muscular structure, just like the vagina, and it's where a fetus will develop, embryo and fetus will develop as pregnancy ensues. So those are the structures you need to know and don't know based on these diagrams. Remember that the top left diagram here is a side view, sort of, for lack of a better word, we took somebody split them down the middle from head right down through their belly button and took off one side of their body, and we're looking in that way. And then this would be a front view if we could see past skin and everything and see where all these structures are. So let's talk a little bit about, I'm just going to pause because you can't see the bottom of the screen there. I'm going to fix that for you. There we go. So let's talk about each of these structures that we just went through quickly. So moving from the outside world inwards, we go past the labia, which are the external part of the system, and we get to the vagina, which is a muscular canal extending from the outside to the cervix. And it would be what we call the birth canal. That is the path the baby follows from the uterus to get to the outside world. Once you get to the end of the vagina, you get a muscular band that separates the vagina from the uterus, and it's called the cervix. We're going to talk a lot about the cervix when we're talking about pregnancy and childbirth, but for now we're not going to get into too much related to that. Just know that it's a muscular band, sort of the dividing line between the vagina and the uterus. I do want to mention, though, cervical cancer, and just to point out that it's one of the major forms of cancer in women. Obviously, men don't get it because we don't have a cervix. And something called a Pap test is done frequently for females, and it basically involves collecting cells from the cervix to test for abnormalities. And it's actually human papillomavirus, or HPV, that is used to determine if a woman has cervical cancer or not. We believe that HPV is one of the precursors, this virus being present is one of the precursors to the development of cervical cancer. And so often, and I'm sure most Canadian girls or young women have been vaccinated for HPV in order to protect them from the virus, which could lead to cervical cancer. And as far as I know, we also can vaccinate males as well, because HPV can be passed through sexual activity. So something to be aware of. So if we can vaccinate ourselves against HPV, then we lower the chances of getting cervical cancer. So moving on, from the cervix we arrive at the uterus, and I'm just going to move my video to the other side so we can see up there. The uterus, or womb, I'd prefer you to call it uterus, is a hollow pear-shaped organ located between the bladder and the anus in females. Bladder being the front side of the body, anus being the back side of the body. And it's where a fetus will develop, embryo and fetus will develop during childbirth or during pregnancy. The uterus has two layers. It has a muscular outer lining and a glandular inner lining we call the endometrium. Why I'm taking the time to point this out is that this muscular outer lining is very important, because it's involved in the actual act of childbirth, ensuring that a baby can be pushed out. And then the glandular inner lining, I think you guys should recognize the root of that is glands. And so the endometrium is the glandular inner lining. And we're going to talk a lot about the endometrium because it does release hormones and it plays a major role in pregnancy. So do pay attention and watch out for that. On either side of the uterus are fallopian tubes. So there's one fallopian tube on the left side, one fallopian tube on the right side, also known as an oviduct. That's the second time we've used the root ovi. Ovi means egg. So the fallopian tubes are the connection then between the ovaries and the uterus, and it is where a egg will pass in hopes of meeting sperm along the way, so that fertilization can occur. The last part that we reach are the female gonads, which are the egg, or the ovaries, pardon me, and that's where the ova is plural for ovum. That's where the ova are stored, the eggs are stored. And contrary to the male reproductive system, this is important for you guys to recognize. Females are born with all the eggs they ever will have, all the immature ova or oocytes that they will be born with. They're born with that, and that's all they will ever have. In males, we produce sperm at the onset of puberty, millions and millions and millions and millions of them, whereas in the female system, all of the eggs are there at birth. And then once puberty is achieved, then what ends up happening is the eggs are released. One mature egg is released a month as part of the menstrual cycle, and we will get to the menstrual cycle in concept B3. The ovaries alternate months releasing eggs, so the left one might release one and the right one will release the following month, and they alternate. The ovaries contain about 400,000 follicles and release a few of these follicles each a month, and one of those follicles will be a mature egg. And then the remainder are other support structures associated with that, which we will get to shortly as well. So ovaries we're going to focus in on quite a bit. Just as we did with the male reproductive system, I wanted to spend just a few minutes talking about the female secondary sexual characteristics in comparison to males. Remember, these are characteristics that are associated in males with the release of testosterone, and they're characteristics that are secondary, meaning they've developed after the onset of puberty. They are not present when one is born. So the primary sexual characteristics for females would be the internal genitalia, like the vagina, cervix, uterus, fallopian tubes, ovaries. In males, it was the penis, the testes, and all the structures associated with that. The secondary sexual characteristics develop during the course of puberty and beyond. And so for females, this includes enlarged breasts, which we know have the purpose of being able to supply, well, they have mammary glands, which after pregnancy will produce milk, in breast milk, in order for the baby to develop rapidly to start with. Females generally have less facial hair than men. And again, these are generalizations. This is not always true for each of these. On a person-by-person basis, it really depends on the individual. Hair growth in armpits in the pubic region, same as males, onset at puberty. Males have wider hips than men do, or females have wider hips than men do when we compare it to the shoulders. Those hips, again, we talked about that before. The wider hips are helping to provide room for childbirth, for a baby to travel down the birth canal and be born. In men, we said that fat deposited usually around our midsection. We get that beer gut. In females, we end up with fat deposits around the buttocks and hips and breasts as well. Females generally, not always true, but generally have more body fat than men. Hands and feet tend to usually be smaller or narrower, and the angle from thigh to ankle is slightly bent, and that's just, again, with the hips, making that sort of shape that comes down a little bit, and the hips being wider than the ankles because of the need to provide room for the passage of the baby during childbirth. So those are the female secondary sexual characteristics. So what we're going to do now is we're going to shift gears into talking about, like we did with males, we talked about the process of spermatogenesis. Now we're going to talk about the process that goes on to create eggs, or mature eggs in this case. So that's an important point, is I'm going to be very conscious to try to say that we're maturing eggs once a month rather than creating eggs once a month. Remembering that the ovaries, when a female is born, contain all of the follicles, all of the eggs that will be there for the rest of their sexually mature lives. So the female ovum is much larger than its male counterpart. I've told you this before. The sperm, or the male gamete, is very small. It's the smallest cell in the human body, or half the human bodies. And the female, the egg, or the ovum, is actually the largest when we look at it. And the egg, when it's fully matured, contains 23 chromosomes, just like a sperm does. Remember, that's half the complement of chromosomes that a normal cell would have. And the goal is to bring those two together so that when we get fertilization, the 23 and the 23 come together to make 46 chromosomes, a full complement of chromosomes. And the egg is also full of a bunch of nutrients that sperm doesn't have. Sperm just has the role of getting from point A to point B and hopefully encountering an egg along the way. The egg must actually have enough nutrients and other support structures in it so that once fertilization occurs, it can start dividing to create an embryo and ultimately a baby when everything is done. So oogenesis is the formation and development of a mature ovum, and the process occurs in the ovaries in structures we call follicles. Okay, these follicles are composed of one ovum surrounded by a single layer of cells, and around 12 to 20 of these follicles develop at the beginning of each menstrual cycle. And one eventually will emerge as the dominant follicle, or what we call a secondary or dominant follicle, once we get to the appropriate point of the menstrual cycle. And when we get far enough into that, that was a nice straight line. We'll talk more about that when we get to the menstrual cycle in concept B3. The dominant follicle then will increase in size for about 14 days. And then what happens, and I'll have a picture of this, and it grosses some people out, but it's actually really cool. the follicle will actually end up fusing with the outside of the ovary and be released into the fallopian tube. So on day 14 of the menstrual cycle, after that dominant follicle has increased in size over the course of 14 days, it basically merges with the outside of the ovary and spills out into the fallopian tube. So it contains what we call a secondary oocyte, and it gets released. This oocyte being released is called ovulation. So that is the point at which an egg, quote unquote, in this case we'll call it an oocyte, is released into the fallopian tubes. At this point, from this point forward, a sperm now can find the egg. The secondary oocyte is also created by meiotic division. So it was full complement by the time it's released. It has 23 chromosomes, so it is reduced from 46 to 23. And it also creates 4 polar bodies, and we'll talk about what those are later on. The secondary oocyte is the egg or ovum that enters the fallopian tube during ovulation in the hopes of finding a sperm, which will fertilize it. After being released from the ovary, the secondary oocyte travels down the fallopian tube, pushed along by cilia, little finger-like projections that push it along in the hopes of encountering a healthy sperm. If it encounters a healthy sperm, then fertilization occurs. If it does not encounter a healthy sperm and no fertilization occurs, then it dies after about 24 hours, and the woman's menstrual cycle continues. If fertilization occurs, the menstrual cycle stops and pregnancy begins. Okay, so that's what we'll get into in B3 and B4. So just a couple of diagrams indicating what's going on in the genesis of the follicle, and this diagram's a little bit confusing. So we'll kind of just sort of track our way through what's going on in here. So this is an ovary. This is then the fallopian tube will actually wrap itself around here and catch what will be released. What we've got going on here is this whole area would be filled with all of these little tiny undeveloped follicles that the female was born with. And then what ends up happening is those follicles at the beginning of the menstrual cycle, day 1 of the menstrual cycle, begin to develop. And then one of these will develop into a primary follicle, which is going to be surrounded by some cells that are support cells, basically. And that follicle begins to enlarge and grow all the organelles it's going to need in order to develop into a properly mature egg, what we call a secondary oocyte. So what you're seeing here is the primary follicle is here with that purpley structure in there, which is the primary oocyte. As the menstrual cycle continues along, so this is kind of progression of time here as well, that primary follicle continues to develop. We develop a fluid-filled cavity here. We get a mature follicle, so we are approaching ovulation, so we're right around day 14. There is our primary oocyte that is just developed into a secondary oocyte, which is then spilled out. The follicle ruptures and releases the egg into the fallopian tube. Okay, so the secondary oocyte. What's going to happen after that is we're going to develop something called the corpus luteum, which we'll talk about shortly here, that will start to take over releasing some hormones that will be necessary to sustain pregnancy. If fertilization occurs and that fertilized egg and ultimately embryo implants in the endometrium, then this corpus luteum will stay there for the rest of pregnancy, helping to supply hormones and those kinds of things to the female system. If fertilization doesn't occur and implantation doesn't occur, then the corpus luteum breaks down, hormone levels change, and the menstrual cycle starts again. And we'll talk about what that actually entails in concept B3. This is the diagram I was talking about earlier. This shows the actual dominant follicle. Here's the ovary, a surgical instrument, and what we're seeing here is the egg actually being released. So this is a dominant egg being released into the fallopian tube. from this follicle that is fused with the outside of the ovary. So I think it's a pretty interesting diagram, and you can sort of see that that cell is pretty large, because all of this stuff over here is made up of cells too, but that's a pretty big cell when you think about it. You can't see individual cells in any of these structures, but you can certainly see that one individual cell, that secondary oocyte that's been released. So just to take a second to talk about the corpus luteum and what it does, because it is associated with hormones. And I'm not going to talk about hormones in B2. We will get to talking about hormones in B3 when we work on the menstrual cycle. So the corpus luteum, basically any non-dominant follicle cells surrounding the dominant follicle will develop into the corpus luteum after the ovum has been released. And this structure contains hormones that are essential for pregnancy, particularly estrogen and progesterone, which will be released throughout pregnancy, and we'll talk in B3 about what those hormones actually do. If there is no fertilization, like I said, the corpus luteum breaks down after about 10 days, which stops the release of estrogen and progesterone, and which will kick off the beginning of the menstrual cycle again, which starts with menses or the shedding of the endometrium, which we'll get to in B3. If there is fertilization, the corpus luteum continues to grow during pregnancy and continues to supply estrogen and progesterone to the system. Okay. Just a quick note here. So following fertilization, then the ovum produced by the dominant follicle, we already said, moves down the fallopian tube and progresses down the fallopian tube and theoretically encounters a sperm. If it does, then we get the process of fertilization, and what we create is a zygote. Okay, the zygote is the term we use when sperm and egg fuse or come together. Sperm drops off its chromosomes into the egg, and then the egg incorporates those chromosomes as part of its genetic structure and begins to develop into an embryo by the time it implants in the uterus. So from there, that fertilized egg or zygote travels to the uterus, which is lined with the endometrium, and then that little zygote implants into the endometrium and begins to develop as an embryo and then ultimately a fetus. So that's the general gist of the female reproductive system, the structures associated with it, and the process of oogenesis in general. What I'm going to get you to do now is make sure, just like with the male reproductive system, you're understanding how those structures support the functions of the system. So in particular, what is the purpose of the vagina? What is the purpose of the cervix, which we didn't talk about yet? We'll get to uterus, fallopian tubes, ovaries. How do they all work? How do they support the process of fertilization of an egg, and then ultimately the development of an embryo into a fetus and a baby? So we're gonna work towards that, but try to make those connections as we move forward. This is the end of the lesson. That was about 28 minutes of me talking at you, so I'm going to wrap it up quickly with just telling you, and I'll also put this on the Google Classroom, what you guys need to be doing to move forward. I'm going to post 2 worksheets up there that will give you guys some practice based on what we've just talked about. Worksheet 1 will be a good comparison of the male and female reproductive systems, and worksheet 2 is a kind of B2, B3 worksheet. So it's going to be the first 2 questions you can do on that, questions 1 and 2, which will be associated with the female process of oogenesis, as well as talking about secondary sexual characteristics. Don't do question 3 on that just yet until we've got concept B3. Once you guys are ready, once you've had a chance to read through everything, work through the worksheets, check the keys that I posted on the Google Classroom, then you can move on to looking at doing the quiz when you're ready for that. But don't do it before then. Okay. As always, if you guys have questions, find me online. I'll post office hours and ask any questions you need via email. If anything isn't quite clear, I may also find a couple of videos to post up there for you too. just to clarify everything we've talked about. Hopefully this makes sense. And when you're ready, do the quiz, and then we'll move on to concept B3. Thanks for watching.